How do you think the abortion rights groups would respond if a doctor gravely injured an abortion patient, then left her in the care of staff that literally plunked her into a wheelchair and shoved her out the door to die? If you think they'd unite against him and stand in solidarity with her orphaned child, you are sadly mistaken. This is Christina with the Sisyphean Journal, and today is December 13th.
Today we're going to look at a theme that I looked at before, and that is how again, I'm not talking about your normal, ordinary, everyday garden variety pro-choice citizen. I'm talking about your people who do abortion activism as an important part of their lives, kind of the self-appointed protectors of women's lives and health and choices and blah, 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 blah. And to really, really illustrate this, you can look at the death of Sharon Hamtlin. So she died on this date, December 13th in 1996. And you need to have a little bit of background first. In one session of a National Abortion Federation risk management seminar that I listened to, they were having a little discussion period at the end of one presentation, and one participant talked about that when he pulled bowel, which is when you accidentally push the forceps back through the back of the uterus and you think you're grabbing a piece of baby and you pull it out and you see it's a loop of the woman's intestine. It's called pulling bowel. And he said that when he pulled bowel, he'd just stuff it back through the hole, give the woman some extra drugs to kind of contract the uterus and control bleeding, keep her a little bit longer, monitor a little bit closely, but then send her home none the wiser. And if I recall correctly, the moderator was Michael Burnhill, who was then director of Planned Parenthood Federation, medical director of Planned Parenthood Federation of America. And he ripped this guy a new asshole, and he talked about what the recommended procedure was to deal with pulled bowel, because this is a potentially fatal injury. And he asked, how many of you handle pulled bowel this way? Stuff it back in, a few extra drugs, cross your fingers, send her home. And he counted 6 participants who raised their hands. Now, this is a gathering of abortion practitioners who are held up as the most diligent and professional. And these are people who care enough to actually go to these meetings to try to at least uphold some standards. And 6 of them, even after getting chewed out, are like, yeah, I just stuff it back in and hope for the best. And it was only going to be a matter of time before one of them killed somebody. And that is when the unfortunate Sharon Hamtlin came into the picture. So Sharon was a single mother. She worked part-time at Burger King while attending community college. Her dream was to become a nurse, get off welfare. So she went to a ladies' choice medical clinic, which was run by Dr. Bruce Steir. Very appropriately, rhymes with fear. Steir was already on probation with the medical board at the time. He had a history of botching abortions, including causing uterine perforations. He'd been found negligent in 6 abortion cases, 3 of which required the woman to undergo a hysterectomy. One woman had to have a fetal skull removed from a tear in her uterus. And Steir ran the facility, but Joseph Durante owned the facility, and he also was on probation with the medical board at the time Sharon went for her abortion. He had attempted a late abortion, which resulted in the birth of a live but injured infant. Now, Sharon's mother said that she now, after the fact, understood that Durante and Steir, because they were on probation, should not have been getting Medi-Cal payments, but they got it anyway. She did not understand that this was just a private doctor's office, that it was not a licensed and inspected ambulatory surgical office. So in other words, it was a fake clinic. Not a pro-life center where they don't pretend to be a clinic because they're giving you diapers and baby clothes and maternity clothes and cribs and car seats and budgeting classes and help looking for jobs and blah, 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 and not actually doing medical things. This is a place that's doing medical things and deliberately looking like a clinic when it's not. So, Sharon and her mother had no idea that this was just the private practice of these two guys with a history of quackery. They went in thinking that it was a licensed, inspected, safe clinic. So now Sharon was 20 weeks pregnant. Nancy Miles, an ultrasound technician who was assisting Steir during the abortion, said that Steir was having trouble locating and extracting the fetal skull, which it's common that's very difficult to get hold of. It's round, it's slippery. Imagine taking a pair of needle nose pliers and trying to pick up a slippery ping pong ball. Okay, so she said that Steir was kind of fishing around, got a strange look on his face, and said, "I think I pulled bowel." Less than an hour after Sharon's abortion was done, Steir left. Sharon was still in recovery. In the meantime, Sharon's mom was waiting in the waiting room. She was waiting outside the clinic, probably in the car, with Sharon's son, her 3-year-old son. And I'm just going to quote Doris, Sharon's mother. "Maybe around 3 p.m. I took Curtis inside to use the bathroom. I saw a gray-haired man dressed in green surgical clothes sitting at a desk. He said, 'You know she is far along.' I said, 'No, I didn't know because she didn't tell me.' Then I saw Sharon in the recovery room about 3:30 or 4 o'clock p.m. She looked so bad that I felt scared. She was lying on a lazy boy-style chair with an IV in her left arm and a blood pressure cuff on the other. She looked very pale. Her eyes were partially open, and I could see only the whites of her eyes as if she were in shock. She was not speaking, and her whole body was shaking real hard in big shivers. Her legs were especially bad. The doctor said she didn't react to the drugs well." And again, Doris's words. "A woman came in and said that Sharon didn't need the blankets that were on her already and pulled the blankets off. Other girls in the recovery room were vomiting, and the attendant woman told the girls to keep vomiting. The vomiting was good for them at this time. I went back to the waiting room, and a Spanish lady came out and said Sharon would be ready in a few minutes as soon as the IV was finished. Sharon was in recovery for only about 45 minutes because at 5 p.m. they came out and said she was ready to leave. I heard someone say that the doctor was real busy and he had to rush out like he was going to the airport, something about him having to go to Sacramento or San Francisco. I saw 2 women struggling to place Sharon in a wheelchair. Sharon could not walk at all, and she was not speaking. She looked very, very pale now. So she couldn't walk. She's pale. Her eyes are rolling up in her head, and they just put her in a wheelchair and shove her out the door. The women loaded Sharon into the backseat of her mother's car. And Sharon's mother, of course, she thinks this is a licensed clinic. She has no idea that Sharon is not supposed to be this dopey, this weak. So she put Curtis and Sharon in the car. And again, Doris said, "On the way home to Barstow, I stopped at Wendy's to get a sandwich for little Curtis. I tried to wake Sharon, but all she said was, 'Huh?' Then Curtis said, 'Mama, I love you. Do you need anything? Are you okay?' And Sharon said, 'Okay, I'll take a drink.' Sharon was lying in the back seat of the car and said to Curtis, 'Come on back with me, Curtis. I love you, and so I could hold you and you could go to sleep.' She was silent for about 1 hour. Near Victorville, she said, 'I'm so hot. Please let the window down.' I opened the window a bit. After that, Sharon was silent forever. I went home to Barstow and I saw that Sharon, still laying in the back seat, was naked from the waist up, having removed her shirt, shoes, and socks. I started yelling, 'Sharon, Sharon, wake up!' But she didn't, and my husband said, 'Call 911. But it was too late. Sharon had already bled to death from the hole in her uterus. So, because of the circumstances, he was already on probation, he was already in trouble. He had told his assistant that he pulled bowel, and then he left and let Sharon be loaded, pale and bleeding, into a wheelchair, shoved out the door. Steir was arrested and charged with murder in Sharon's death. Now, you would think that the designated guardians of women's lives and health would be, lock this bastard up after what he did to her. This was inexcusable. But no. Pro-choice organizations, including the leadership of NOW, National Organization for Women, the National Abortion Federation, and the ACLU of California, and the California Abortion and Reproductive Rights League, rallied around Steir. One supporter stood outside the courthouse with a sign reading, "Abortion doctors are heroes, defend Dr. Bruce Steir." The Feminist Women's Health Center in Chico, with which he was once affiliated, set up a defense committee and raised funds. The Steir Defense Committee painted a glowing picture of him, just totally ignoring the women he'd injured and the disciplinary actions. Dr. Steir, a board-certified OBGYN, has performed abortion since the Roe v. Wade decision in 1973. He has traveled extensively throughout the state, providing services to women both in urban and rural areas. He, like many abortion doctors, has worked in a variety of clinics over the years, including physicians' offices, feminist clinics, and Planned Parenthood. What does that say about Planned Parenthood that they had this turkey working for them? He worked for the Feminist Women's Health Center in Chico, Redding, Sacramento, and Santa Rosa for 12 years and served as medical director. Now, if you look at the trouble this guy's been in, I think it says bad things about them, not good things about him, that he was working in all these places. So eventually Steir entered a guilty plea in exchange for getting a light sentence. He was sentenced to a year in prison with 6 months of the sentence suspended in lieu of community service, and he got 5 years of probation. At the sentencing hearing, 4 years after Sharon's death, her father testified that he still often pulled over to the side of the road, looked at his daughter's picture, and wept. Steir was released after serving only 4 months of his sentence, and he's still viewed as a martyr among abortion rights activists. He even wrote a book called Jailhouse Journal of an OBGYN, which is gushed over by abortion rights activists. One blogger elevated into Dr. Steir, warrior for women. So, that the idea that Steir was railroaded just because he did abortions really doesn't hold much water when you look at how many other women died from abortion malpractice in California without a single doctor being prosecuted. If there was some huge anti-abortion conspiracy to persecute hapless providers of vital reproductive health care services, there'd be homicide charges filed every time a patient dies. And, but the pro-choice activists, the high-level activists, the groups, just totally fawn over Steir and ignore Sharon. She just doesn't matter. And I'll give you Doris's closing thoughts. I cry every day for the terrible loss of my daughter, and I am overwhelmed that 3-year-old Curtis has had his mother taken away forever. My husband is sick with grief, has terrible head pain, is under the care of a doctor for this, and has been taking strong medication since Sharon's death. My prayer is that these doctors will be stopped immediately so no other girl will be killed and so no other family will have to suffer as we have. But it's only the pro-lifers who are standing with Sharon's family. The abortion rights movement stands with the guy who killed her. Just think about that when you think about how they praise these brave, stalwart abortion providers. They're praising the likes of Bruce Steir.